Sun Pharma is proud to be the presenting sponsor of the 2024 National Psoriasis Foundation Medicare Education Series. Organizations like the MPF can change someone's psoriasis journey for the better, and we at Sun Pharma also understand how important it is for patients like you to receive a safe and effective treatment option at an affordable cost. For those with Medicare Part B with a supplement, an injection administered by your doctor may be available for as little as $0. Ask your doctor about a treatment option that may be right for you.
Hello, and thank you for viewing the 2025 Medicare Changes and What They Mean for You webinar. My name is Bev Bromfield, Patient Education Programs Manager here at NPF. Before we start, a few words about what the National Psoriasis Foundation does. At the heart of all we do is our mission to drive efforts to cure psoriatic disease and improve the lives of those affected. We accomplish our mission by funding research with over $30 million awarded in grants and fellowships, collaborative and transformational research initiatives. New grant and fellowship recipients were awarded in July. The MPF also offers education for those living with psoriatic disease and encourages all to become involved with our mission. Learn more about our research, education, and how you can become involved by viewing the links listed on the screen. Now I'd like to take a moment to acknowledge and thank our sponsors, Sun Pharma and Novartis, for their support of today's webinar. Thank you. It's my sincere pleasure to introduce you to our guest moderator for today's webinar, Jason Harris, who is the Vice President of Government Relations and Advocacy here at NPF. Jason joined NPF in 2022 with over a decade of experience leading efforts to address health policy that benefit those with chronic health conditions from those with psoriasis, and previously with the Lupus Foundation of America, the National Health Council, and the ALS Association. Thank you, Jason, for being here with us today.
Thanks, Bev. Really excited for the presentation and discussion that we'll get into in just a second. Joining us today for this Medicare update is our speaker, author and advisor, Jason S. Mackey from Medicare Blueprint Advisors, LLC. Jason is a U.S. Air Force veteran. After completing his service, he returned to join his family's insurance agency, and in 2014 became president of Medicare Blueprint Advisors, which works to guide clients through the Medicare maze to find the best solutions for their clients. With his vast knowledge of the Medicare program, during a prep call, we were all chatting, and Jason mentioned that he enjoys helping people simplify the process, including that he gets a lot of satisfaction from seeing the relief a person has after designing their plan. So hopefully after this webinar today, some folks will have a little bit of relief as they go into this process. So it's my pleasure to welcome Jason as our speaker for this webinar addressing recent changes to Medicare. Welcome. Thank you for your service as well to the country and taking the time to be here today. So Jason, going to kick it to you.
Thank you, and I appreciate that. Okay, so this is just going to give you an update of what's currently happening with the Medicare prescription plans and some of the big changes that are going to happen. I do view them overall as some really positive changes, just some things that you just need to be aware of when you're looking at your options for 2025. So with Medicare, you basically have two choices. Okay, you have original Medicare where you have Part A and Part B, and then you can buy a Medicare supplement to fill in those holes that Medicare doesn't cover. And then you can purchase a standalone, what they call Part D prescription drug plan. Your other option is to go with a Medicare Advantage plan, also called Part C, and typically includes the prescription drug benefit. Now, no matter which way you go, you still have to have Part A and Part B. A lot of people have told people if you're on Medicare Advantage plan, you don't have Part B, and that's incorrect. So, all right, so I'm going to go over a little bit about Medigap, or what is commonly called Medicare supplement plans, and what those will cover. So under Medicare Part B, which is all of your outpatient services, so think of outpatient surgery, emergency room, your doctor's visits, testing, durable medical equipment, all of that falls under Medicare Part B, and it does have a calendar year deductible. This year it's $240. It does go up a little bit each year, and it's announced in the fall. The big thing that I like to point out to people is the Medicare Part B medication. So things such as chemo, infusions, and injections done in a doctor's office fall under Medicare Part B, and the 20% that you pay after that deductible has no cap on it. And that's why we recommend, if you stay with original Medicare, that you do look at getting a Medicare supplement to fill in those holes. So the Medicare supplements in most states is standardized. So if you look at Plan G, which is the most popular plan in the country, it's the same no matter which insurance company you get it through. And as you can see, the reason why it's the most popular is it fills in all of the holes that Medicare does not, even the Part B coinsurance at 20% that we're talking about if you did have to have outpatient services or chemotherapy, infusions, or injections. The only thing it does not cover is that Part B deductible, so the calendar year deductible. The next most popular plan is Plan N, and that one is very similar to Plan G, except after that deductible, you may pay up to $20 for an office visit or up to $50 to go to the emergency room. The other major difference between the plan is it doesn't cover Part B excess charges. And what that is if you go to any provider in the United States that accepts Medicare, they can accept Medicare's payment in full, but there are some providers that can balance bill, and in Medicare's terms, that's called an excess charge. So there is a limiting factor on how much they can increase their cost by, but Plan N does not have that balance bill protection that Plan G has. If you are currently on Medicare and you're on Medicare before 2020, January 2020, you're actually eligible to go with the Plan C or Plan F, and Plan F is still a very popular plan for those insureds. And if you have Plan F, you get to keep it. You can even switch to another insurance company that offers Plan F. They still offer those. So Medicare Advantage plans, also known as Part C, those are actually, you are paying your Medicare Part B premiums to Medicare, but what they actually do is they transfer that risk over to the insurance company. So now you are purchasing a plan directly with an insurance company, and they're responsible for administering your claims. Medicare pays them a lump sum amount per month to take care of you. And by CMS or Medicare regulations, they must cover the same items as original Medicare, and many of them offer some additional benefits, such as dental, vision, hearing, and some over-the-counter reimbursements. They are network-based, so they're going to look and feel a lot like an employer-based plan, where you have to see providers that are in their network. And some of them may require a referral to see a specialist. So you would just want to make sure that if you are considering these plans, that you do look to see if that's a requirement. And again, you are required to pay the Part B premium, even if you have a Medicare Advantage plan. So this is kind of a typical summary of what a benefit will look like. So you can see you have an annual out-of-pocket maximum. Some may be lower. That's just the maximum allowed for 2024. You'll have offices at copays to go to primary care and specialist. What's a little bit different than an employer-based plan is that these are, when you're inpatient, you pay a per day amount. And then if you're in there for longer than the per day maximum, then it continues to pay 100% for the rest of that visit. The big thing that I like to point out about this is the last line is Medicare Part B drugs, such as the chemo infusions done in a doctor's office, and also injections done in a doctor's office. That falls under that Medicare Part B, where you would pay 20% until you hit that annual out-of-pocket maximum. So again, if you're taking any type of those treatments, then you're going to want to look at a plan that has a lower maximum out-of-pocket, if possible, to help reduce your total exposure. So the Medicare Part D prescription plan, this is what's going to have the biggest change for this year. And that's what we're going to spend the rest of the time on, is going through those changes. And no matter what, if you go with a Medicare supplement and buy a Part D plan separately, or your Medicare Advantage plan includes the Part D prescription drug plan, they both work the same way when it comes to the prescriptions. So currently, there were four different levels of the Medicare prescription drug plan, which was an annual deductible, and the initial coverage level, and then the coverage gap, which a lot of people call the donut hole, and then the catastrophic coverage. So I'm going to go into detail with those a little bit more. So this year, the annual deductible is a maximum of $545, although some plans can have a lower deductible. And then also, if you have any generic medications, usually those tier one, tier two generic medications are not subject to the deductible on most plans. Then once you hit the next stage, which is called the initial coverage level, then you would pay a coinsurance or copayment for your medications. So each plan is a little bit different. So I'll kind of give an example. Let's just say you were taking a drug that costs $400 per month. You may be paying a $40 or $50 copay for that medication, but the cost, the $400 cost would actually count towards that 5,030 initial coverage limit. So then once your total medication cost, not what you pay, your total medication cost hit 5,030, then you moved into the coverage gap, which was also called the donut hole. And then during that time, you pay 25% of the cost of your brand name medications and also 25% of the cost of your generics. And you actually pay that until your total drug costs reach $8,000 a year, which usually with the formula is about $3,300 of out of pocket for most consumers. So that's the maximum. And then you would move into the last level. I'm sorry. Uh, this was the stuff that's not covered by the coverage gap. So your deductible, your coinsurance and copayments that you get that you pay, that goes towards that amount. The discount, which is the manufacturer discount, they actually gave you a 70% discount off the brand cost. That went towards your donut hole, filling that gap, and then what you paid out of pocket. So once you did that and reached that total of 8,000, that's when you got to the catastrophic coverage. Things that did not count towards the coverage gap were your monthly drug plan premium, if you had any, the pharmacy dispensing fees, and then if you were getting medications that were not either covered by the plan or you're getting them from another out-of-network pharmacy, then you that would not count as well. So once you hit that 8,000, then you moved into the catastrophic phase. Then you do not pay anything else for the remainder of this calendar year. In prior years, you had to pay 5% and there was no cap to it. So that was an improvement that was made in 2024. So that was a huge help for a lot of our clients. But now moving into 2025, you actually see instead of being four stages, there's three. So they've eliminated the donut hole. So now we only have the three, and I'm going to go into a little bit more detail. So the deductible is actually going to be a maximum of $590 in 2025. Again, we're going to see some plans that have lower deductibles that typically have a higher premium if you're going to have a lower deductible to get your brand name medications. Now the initial coverage level, there still may be some co-payments or co-insurance that you would pay, but we don't know because they have not released all the plans yet. But we think that we're going to see a 25% cost share for all medications, even during the initial coverage level, until you reach 2,000 max out of your pocket. So once you hit a total of $2,000, then the plan will pay 100% of your covered medications for the remainder of the calendar year. So this is a very big improvement. So we're excited that this is going to provide a lot of help to a lot of our clients. So you'll move into the catastrophic level, but basically it's the $2,000 limit. You don't pay anything beyond that. They are going to index that $2,000 cap to inflation for next, starting in 2026. They have not released the formula that they're going to use, so there may be just an incremental increase in the max out of pocket each year. I do want to just briefly mention that there is a late enrollment penalty because there are some people that say they're not taking any medications or very little medications, so they'll opt not to get a Medicare Part D plan. But the penalties are pretty significant, and they're lifetime penalties, and they're permanent, and they're increasing each year. So how it works is for every month that you go without having a Part D prescription plan when you should have had one and you did not have other credible coverage, which we'll cover in just a few minutes, then there is a penalty that's a 1% penalty with no cap. So if you waited 12 months to get your Part D prescription plan when you should have purchased one, there'd be a 12% penalty on the premium for life. There are some rare exceptions where you can actually have that removed. Okay, so when you're looking at these different Part D prescription drug plans, you're going to see some out there that are relatively inexpensive each month, and then some that cost even several $100s per month. And there's a couple reasons. The first one is the formularies for the lower cost ones. They're required to have at least 2 medications in each therapeutic class. So they may have a smaller formulary, that list of covered drugs that you are eligible to get. The second thing is that they have what they call medication therapy management. So I have the three most common on there. Prior authorization, which is you and your provider will have to show that it's medically necessary for that medication. So you'll have to get prior approval for that. The second one is step therapy, and this is that they make you use a less expensive drug to prove that it's ineffective before they let you have a more expensive medication to treat that same condition. And I do see that the prior authorizations and the step therapies increasing in 2025. So I'll just show you or explain how to look out for that when you're comparing plans. The last one is quantity limits. We don't run into this very often, just mainly on controlled substances. They do limit those to 30 days, but any other medications, we don't really run into somebody overprescribing a quantity. So we have a few additional changes to review. So the standalone Part D plans actually could participate in what they call voluntary cost reduction program. And that came out on July 29th. And that just basically said that the CMS was going to help subsidize some of the premiums. We think most, if not all, Part D plans are going to take that subsidy. And that was going to help offset some of these increases because as a result of the $2,000 cap, we did think that premiums were going to go up, some being even $50 or $100 a month. We're seeing that that's not going to be the case with some of the provider or carriers telling us what they're going to charge for next year. So it's not going to be as much of a premium shock as we initially anticipated. So that's a good thing. We do see that these individual Part D plans that you would buy with a Medicare supplement, that the formularies are going to be a little bit smaller, are going to be more restrictive. So when you're comparing plans, you're not only going to want to look at the monthly premium, but inside of, even if you go to Medicare.gov, it will show you by plan and by medication what the restrictions are if it does have prior authorization or has step therapy. So you may want to potentially pay a little bit more in monthly premium for a plan that has less prior authorizations or restrictions to it. From what we're seeing, many of the Medicare Advantage plans with the prescription drugs, their formularies or list of covered drugs are going to be pretty much unchanged. So that's a good benefit. So it won't be as much disruption in that market as well. One thing that is that's also to be on the lookout, if you're on Medicare and you're still covered by an employer plan, you will not have those penalties accrue that I spoke about earlier. But you do need to make sure that your employer plan that you're covered by is called credible coverage. So each fall, you'll receive a letter from the employer stating if the plan is considered credible or not. They were going to make a big change that was going to cause a lot of plans to become non-credible, and that has been deferred to at least 2026, hopefully longer. So just make sure that you verify that your coverage through the employer plan is credible, so you do not get stuck with a penalty down the road. Another great improvement is the Medicare prescription payment plan. It's been dubbed Part D smoothing, which I think is great. So if you are taking a medication or medications and it is likely that you're going to hit the $2,000 cap, you're actually able to pay over on a monthly basis. So let's say that you are taking medications and you're expected to hit the $2,000 cap. In January, when you go to the pharmacy, they will provide you with a letter notifying you of this Part D smoothing program and your eligibility. If you decide to opt into this, then the actual Part D insurance company that you are covered by will give the $2,000 to the pharmacy, and then you will set up a payment plan with the carrier itself. So the main details of this have not been fully released yet, but you will be provided a letter at the pharmacy notifying you of this new payment program.
And I just want to reemphasize one thing on that, Jason. So, this smoothing, as we've dubbed it, or as everyone has dubbed it, you need to opt in. You're not going to automatically fall into it. So you got to be on the lookout.
Yes, absolutely. And that if your medication costs are even expected to go over $600 for the year, the pharmacy is supposed to provide you a notification of this Part D smoothing program. So you can opt in and opt out at any time during the year. So yeah, it's a great program. I'm glad that they added this. So in addition to your premiums, even if you have a Part D plan with a Medicare supplement or a Medicare Advantage plan, if your income from 2 years ago is above these limits, you will be subject to what they call as an income-related monthly adjustment amount, affectionately called IRMA. And you will be notified by the Part D carrier if you are subject to this. And there are ways to appeal it if you did have a higher income 2 years prior and it's no longer that high. You can appeal that process. Medicare also has an extra help program, also known as low income subsidy, and you may qualify if you're a single person and you have income less than the 22,590 or living with a spouse, or you also go up to 30,660. There are several different savings programs. So if you don't hit that limit, or if you're below that limit, you may have some other additional programs that are available to you. I highly encourage you to look at that if you're even close to these limits, just to make sure you get the benefit. If you're looking at a Medicare Advantage plan, these are the steps I recommend that you follow. There's usually several dozen available to you in each area or each state. And I highly recommend that the first thing you do is review the plan's formulary just to make sure all your medications are covered. That should help eliminate half or more of the plans. And then after that, I would verify that all the providers that you want to see are in the network. That usually dwindles it down further to a more manageable, less than 5 plans to review. Then once you get to that point, then you can look at the benefits such as the dental, the vision, hearing, or over-the-counter benefits, things like that, that are additional coverages through each plan. So that should help you compare. You can use Medicare.gov as a tool to review your plans if you like. They do not list the doctors, so you would be able to at least see the cost of your medications, but you would have to use another resource such as an advisor, or there's other navigators out there that can help you as well. Same thing with Medicare Part D. If you decide to go with original Medicare and a supplement, the separate Part D plan, we just make sure that your medications are covered under the formulary. You can request an exception to have something added to the formulary that's not, but I recommend that you try to find a plan that covers all of your medications so you don't have to worry about that. The second is just make sure that the pharmacies that you want to participate are in the network. If you are thinking about changing pharmacies, you want to verify that as well. A lot of the major chains are in most of these plans, but you do want to double check that. And then again, we still recommend that you get a Part D prescription plan, even if you're not taking any medications, just to avoid those penalties. All right, so that's it. So I'll let Jason kind of take over, and if there's any questions, I'll be happy to answer those.
Absolutely. Well, thank you for such an informative presentation about the 2025 changes for Medicare. We did receive a whole host of questions as a part of the registration, which we won't be able to get to all today, but we'll encourage you to listen to more work in a different format that MPF will be releasing on this topic. So if you did ask those questions, you don't hear them, don't worry, we will get to them. I wanted to actually start out, Jason, just with a step back. So you went through the changes, you showed us what this year looked like, and you walked us through 2025 as well as relates to the redesign and all that. But I think the National Psoriasis Foundation and our advocacy team, we've been wanting to see this kind of out-of-pocket cap for a long time. Yes. It's been happening since Part D was created, right? And these changes are really the biggest changes we've seen since the creation of the program, and now they're set to go into place next year. So I wanted to just give you a little bit, just to kind of talk us through a little bit about that, just to kind of highlight that point that we really are in a new era right now.
Yeah, absolutely. I mean, I've been an advisor for 26 years now, and this is probably one of the biggest changes that I've seen. I mean, it was definitely an improvement when they added the drug card in 2006, but this is the biggest improvement, and I'm actually excited because this is going to provide a lot of relief, and it's so much better to be able to budget what your costs are when you have that $2,000 cap. So, there's a lot of people taking very high cost medications. So for them to be able to budget instead of having this huge cost at the beginning of the year, and then in the middle of the year, they hit that donut hole. It's just a huge improvement that we're really excited for.
Appreciate that. Just scrolling through the questions, I'm kind of going to merge a few that I think are somewhat similar, but a lot of questions relating to, will certain treatments be on an insurance formulary that they're going to look at? And then also a question related to folks that are transitioning into Medicare, the question around why don't the copay assistant cards or things that work in the commercial market help Medicare patients, or generally speaking, that they really can't use those. Just wanted to give you those two questions.
Sure, yeah, and that's some of the the benefit of this $2,000 cap, because you're correct. Many of the copay assistance or pharmacy assistance programs do not work with federally funded programs. So there are still some of the providers out there that are pharmacy manufacturers that do have some support for that, but that's why it's great we have foundations to help fund some of these out-of-pocket costs. But yeah, those coming into Medicare, they need to just talk with their doctor and just make sure that once they're reviewing these plans, that their treatment is going to be covered. One thing I see is what was happening with some of these injectables that people were getting, or that fell under Part D because they were getting them at the pharmacy versus the doctor. they could not afford those once they went on Medicare because they would hit a much higher cap. It was more than $3,000, $4,000 for those medications. So either they had to opt for an infusion if one was available, or they just had to change their treatment, which, nobody wants anybody to have to do that. So I actually foresee some of these patients that didn't really want to do they were doing the home treatments and self-injectables, and then they switched to the infusions basically out of affordability if they were available versus convenience. This is going to allow those patients to basically go back and start using the self-injectables if they want that. Now, it's going to be a cost because, if they're under original Medicare with a supplement, they may have very little out-of-pocket cost for those Part B medications, where under the home injections, it's going to fall under Part D, but you had a $2,000 cap. So at least Medicare beneficiaries are going to have some of those options back to them to where they're gonna, make the choice if it's worth their budget to have that self-injection versus an infusion. So we do see that as a positive as well. There are still some biologics that aren't covered by Medicare for 2024. We don't know how that's going to change in 2025. So that's, again, a reason why every fall from October 15th to December 7th, you really want to review your options to see if there's another plan available next year. Because even if you like your plan this year, the list of covered drugs, if you're on a Medicare Advantage plan, the doctors, all of those can actually change. And you do receive, if you're currently on Medicare, you do receive in September what they call an annual notice of change from the insurance company. It's pretty thick. That's why a lot of people don't review it as thoroughly. But this year, I highly encourage you to review that annual notice of change. It will show you and tell you exactly how you're going to be affected if you stay with that plan. It will tell you if a drug is going to cost more, it's going to be on a different tier level, or if it's not even going to be covered. So be aware of that, and then also review your options, because some plans even may no longer be in the market for 2025. So definitely keep an eye out for that.
Awesome. Yeah. So I think for anyone who had that question, either is going to become new to Medicare or you've been in the program for a little bit, knowing that $2,000 out-of-pocket cap is going to be there for you to help out. So I think, oftentimes we've told people for a long time, like, once you go into Medicare, you got to be on the lookout for this. And, $2,000, still a ton of money, but that is there for you now. And so just want to underscore that, and then underscore the other thing you've mentioned throughout, which is taking the time when open enrollment happens to really take a look at, what do I need? What is it, the doctor that I want in this plan? And, we always say too, like, have a partner with you to go through it, because it's a lot of reading, and it's always helpful to have someone else with you as you're going through it. The other thing I will just highlight as well is that the National Psoriasis Foundation Patient Navigation Center, that's exactly what they're here for. So if you have questions as you're going through it, please get in touch with them. We'll have links to do that as well. But want to just underscore that, because it is such a hectic time, and it is a really important time, because you can end up making a decision that down the line you end up regretting. And actually, I got a question for you on that. Not that someone had a question related to, I made the mistake of going with the Medicare Advantage plan initially, and now I'm not able to get a supplemental plan. I've been denied twice. Is there anything I can do?
Yeah, unfortunately, after you've been on Medicare Part B for 6 months or longer, you do have to answer medical questions to get a Medicare supplement plan, and you can be declined, or they can put pre-existing conditions for up to 6 months on the condition. So there's really not many things you can do once you're past that 6-month window. If you move out of a service area, so you move to another state, and that plan that you're on is no longer available, then that does give you a guarantee issue right in some states to where you can get a Medicare supplement with no questions asked and no pre-existing exclusions.
So just Thank you for that.
Yeah.
I wouldn't have been able to answer that, but that's just trying to underscore that, these decisions are important and you really got to take your time, especially if it's, your first time going into this, that you just want to make sure you get it right.
Right.
Got
Correct.
two more questions for you.
Okay.
The first is sort of another, we'll call it a case scenario, but my husband's 64. When does he enroll for Medicare if he is currently working full time and has healthcare coverage at his workplace? There's a couple varying things that come into play here, but think a lot of people might be in that spot. So
Yeah,
we'd love to hear that answer.
Absolutely. Yeah, I get that question all the time. So, two things to consider. So, if you work for an employer, you or your spouse work for an employer that has over 20 employees, then Medicare would be your secondary coverage. So the employer plan stays primary. So you don't have to do anything. You don't even have to sign up for Medicare if your employer has over 20 employees, unless the employer requires it. There's very few plans that actually require for you to sign up for Medicare. So you do not have to do it. If you have under 20 employees, then you are required because you have to sign up for Part A and Part B, because once you turn 65, your Medicare becomes your primary coverage and your employer plan becomes secondary. So if you don't sign up for Medicare at that time, then the 80% that Medicare would have paid, you're going to be billed for, because your employer plan is only going to pay the 20% that would have been left over after Medicare paid. So it's very important. Under 20 employees, you do need to sign up for Medicare Part A and Part B. And in addition to that, I would highly recommend that you compare the cost of being on the employer plan versus going with just full Medicare and a supplement and a drug plan or a Medicare Advantage plan. Now, as far as when to enroll, you have up to 3 months before your birthday month to sign up for Medicare, and it'll be effective on your at the first of your birthday month. Unless you're born on the first of the month, then your effective date is actually the month prior to your birthday month. You also have up to 3 months after your birthday month to sign up for Medicare, and your Medicare would become effective the first of the month following the day that you applied. So if your birthday was in July, the middle of July, and you signed up in August, then your coverage would not be effective until September 1st.
Thank you.
Sure.
Last question. We've seen this in the news over, I guess, a couple weeks ago, but Medicare recently announced their negotiated prices as a part of the Inflation Reduction Act, and they negotiated 10 drugs with different manufacturers and released some prices, which we won't get into exact specifics on all that right now, but some questions around, will the drugs that have cap prices be added to most insurance company formularies? And I think you alluded to some of the step therapy prior auth things, like anything you're hearing related to sort of that topic and what the impact of those changes might be.
Yeah, absolutely. So I was very impressed with actually the negotiated prices the manufacturers did come down on. So that was a good thing. Those won't actually kick in until 2026. That may have some impact on the formularies of which medications they may add to it. But the cost of most of these treatments will still hit that $2,000 cap if they're under Part D. So it will help the whole Medicare system as far as reducing cost. But I still think that if you are on those expensive medications, you're probably going to hit that $2,000 cap.
Absolutely.
Mm-hmm.
Well, thank you again, Jason, for a really informative presentation, for answering the questions we were able to get to today that we received. Again, really appreciate your help in trying to give us that perspective and let our listeners and community know about these changes and what they mean for them. For our viewers, you can continue to learn about the 2025 Medicare changes that Jason highlighted today through our upcoming events, such as our Soundbites podcast episode with Dr. Alice Gottlieb that will be released on October 22nd, as well as our live town hall event that's going to be in early November. So look out for the exact date where you can bring your questions to our panel members. Watch your email for the invitation and link to register. Now I'll turn this back over to Bev, who will give a quick update on a few additional resources for you.
If you're looking for additional resources to help with your Medicare journey, visit our Medicare Resource Center to learn more about Medicare Parts A, B, C, and D with Patient Navigator at psoriasis.org/Medicare-resource. You can view this webinar and other past webinars on our Watch and Listen site at psoriasis.org/watch-and-listen. While there, listen to our podcast series, Sound Bites, to hear the latest about managing psoriasis and psoriatic arthritis from a variety of experts in the field of psoriatic disease. If you have additional questions about Medicare, psoriasis, psoriatic arthritis, and treatment options, and if you need help finding a healthcare provider near you, contact our Patient Navigation Center by email or phone as indicated on the screen. And finally, thank you, Jason McKay and Jason Harris, for being here today. On behalf of our viewers, we appreciate your discussion about the upcoming changes for Medicare. Thank you also to our viewers. We hope you found the information helpful and encourage you to provide your feedback on this webinar by taking our short questionnaire via the link under the description on the web page for this webinar. We'd love to hear what you think about the presentation and content. Your feedback will help us identify how we can make our webinars better. We value and appreciate your comments. This concludes our presentation for 2025 Medicare changes and what they mean for you. Thank you.